Last but not the least, it is very important to discuss the nerve supply as well as the blood supply of the dorsum of the hand and the posterior aspect of the wrist. And for that reason, in this section of the lecture, we're going to talk about the nerve supply of the dorsum of the hand, why the median nerve, the ulnar nerve, and the radial nerve, and how they actually distribute in terms of the cutaneous nerve distribution. And we're also going to talk about the arteries on the dorsal aspect, such as the princeps pollicis artery, the radialis indicis artery, as well as the dorsal carpal arch, similar to the superficial and deep palmar arches of the hand on the palmar aspect. So talking about the nerve supply, we have the radial nerve, the median nerve, and the ulnar nerve. If we remember the nerve supply of the palm of the hand, we had the lateral 3.5 fingers being supplied by the median nerve. However, the medial 1.5 finger was supplied by the ulnar nerve. But the median nerve actually supplies the whole of the, you can say, palmar aspect of the medial 3.5 fingers, but not the whole of the dorsal aspect of the lateral 3.5 fingers. So the lateral aspect, if we talk about the lateral aspect, so the distal aspect of the fingers of the lateral 3.5 fingers, especially the second and the third digit and the half part of the fourth digit, is actually supplied by the median nerve. Just the proximal aspect is actually supplied by the radial nerve, and similarly the complete dorsal aspect of the first digit or the thumb is also supplied by the radial nerve. And when we talk about the ulnar nerve has the pretty much the same distribution on the palm as well as the dorsum. So it has the medial 1.5 fingers both on the palmar as well as the dorsal aspect. So we can say that median nerve has a greater distribution on the palmar aspect, the radial nerve has a greater distribution on the dorsal aspect, whereas the ulnar nerve has an equal distribution both on the palmar and the dorsal aspect of the hand. Now, talking about the blood supply of the hand, hand is placed and held in different positions, and thus it requires abundance of highly branched arteries and anastomosing arteries, because there are a lot of muscular structures as well, and there are also a lot of awkward positions of the hand because of its prehensile and manipulative functions, and thus it requires a rich blood supply. And we have previously discussed the rich blood supply on the aspect, palmar aspect, but now we are going to talk about the dorsal aspect, in which we're going to talk about the different arteries which are supplying on the dorsal aspect as well. And talking about the dorsal aspect, the majorly we're going to talk about the radialis indicis, we're going to talk about the princeps pollicis, and we're also going to talk about the dorsal carpal arch, similar to the deep and superficial palmar arches on the palmar aspect. We have one arch on the dorsal aspect, which is known as dorsal carpal arch. So let's start off with the princeps pollicis artery. So as you can see, this princeps pollicis artery is oriented around the thumb, because the name pollicis suggests that as well. So its origin is from the radial artery as it turns into the palm. So here we can see this is the radial artery, and here we have the branch, which is the princeps pollicis artery. And the course is that it descends on the palmar aspect, which is this, the palmar aspect of the first metacarpal, and supplies the thumb. It divides at the base of the proximal phalanx and divides into two branches that will run along the sides of the thumb. So both the sides of the thumb are actually supplied by the princeps pollicis artery. Moreover, we have the radialis indicis artery, and as the name suggests, it is associated with the index finger. As you can see here, we have the dorsalis indicis, and similarly here we have the radialis indicis artery as well. And the origin is via the radial artery, and it may arise from the princeps pollicis artery, which actually supplies the thumb as well, which actually originates from the radial artery as well. So it can originate directly from the radial artery, or it can originate from one of the branches of the radial artery, which is the princeps pollicis artery. So the course is that it passes along the lateral side of the index finger to its distal end and supplies the index finger. Then we have the dorsal carpal arch, similar to the superficial and deep palmar arches on the palmar aspect, and its origin is by the radial and ulnar arteries, radial artery from the lateral aspect and ulnar artery from the medial aspect. As you can see here, we have the dorsal carpal arch, and is formed by the radial artery on the lateral aspect here, and here we have the ulnar artery, both giving off their branches to anastomose and make a dorsal carpal arch. The course is that it arches within the fascia of the dorsum of the hand and gives the branches to the metacarpals in the form of the metacarpal arteries. As you can see here, that we have the metacarpal branches of the dorsal carpal arch, and it is a very important on the dorsal aspect for the blood supply on the dorsal aspect of the hand. So that was pretty much about the nerve and the blood supply of the dorsal aspect of the wrist and hand. I hope you learned something new out of it. Thank you very much for watching sqadia.com. Keep on watching for more lectures like this. Thank you.